So we will discuss reporting into REDCap, the reporting requirements based on the state regulations. And then we have our infection preventionist, a nurse who works with our OPHIE division, as well as staff from child care licensing present to answer any questions that you all have in regards to COVID-19 or outbreak reporting in general. So give me a minute to share my screen and then we will get started. Okay, I get a thumbs up. Can you guys see my screen? Okay, cool. All right, so our agenda for today, as I mentioned, we'll review state reporting requirements, review reporting cases to the Division of Public and Behavioral Health, which includes child care licensing and OPHIE. We will also review accessing and reporting into REDCap, CDC recommendations, and then the Q&A. So as a child care licensing facility, you do have a duty to report. So this slide shows the Nevada Administrative Code and Nevada Revised Statute, where it states that you do have to report suspected or confirmed cases of certain communicable diseases and conditions under public health surveillance that are mandated. These items do have to be reported completely and in a timely manner. Usually timely is considered 24 hours after you become aware. So in the event that a parent notifies you that their child is tested positive for COVID or any other illness, RSV is really, cases are increasing right now. So RSV, usually we have like vomiting, diarrhea, which usually end up being noro or something like that. Those items do have to be reported to child care licensing as well as to the HAI team. So who is a mandated reporter? A lot of times, some people feel like child care facilities are not mandated reporters, but this does have a list of those that are considered mandated reporters. And you will see right here, directors of child care facilities or the staff, if the person doesn't have the role of director, the person that is placed in charge is responsible for reporting that information. So as I mentioned, most diseases and conditions are required to be reported within 24 hours. Some require immediate reporting. So I have this list here. I hope that none of your little ones or your staff ever test positive for these items here. But just to go through some of the items on the list: anthrax, botulism, meningococcal disease, polio, rabies. Some things we haven't seen in a while, but those items are reported immediately. So as soon as you become aware of them, you have to report them versus if a child tested positive with COVID, you would have, norovirus, we would say 24 hours to let us know. So another big question that we always got, especially with reporting into REDCap, was, is it a HIPAA violation to enter a child's name, date of birth, and their information? So we are the Public Health Department, and according to HIPAA, that it specifically allows the exchange of protected health information for public health purposes, which if you see at the bottom under the HIPAA rule, public health surveillance or public health investigations or interventions are included in those items. So it is legal for you to provide that information to us. REDCap is a secure database. We do not share the personal information outside of what's necessary. So for instance, with staff, the local health department performs their own contact tracing for that because those individuals are in the community. So we do have to provide them name, date of birth, and phone number, and that's for contact tracing purposes. But that is also shared with another health department, which is provided under the list of protected entities for sharing that information. So we are very careful with the information. I know with daycares that I've worked with, they were very concerned with pushback from parents feeling like their rights were being violated and things of that nature. But it is legal, and you are covered under HIPAA to share that information with us because it does assist us in the investigation of the outbreak that's occurring in your facility. So the initial report, anytime you guys have a confirmed case, you have a form. There's a link that has been provided, and I have it here at the bottom. I believe it went out on the listserv from HCQC or through child care licensing for you guys to report. It provides a form on your facility name, contact name. I believe it asks for the email address, how many cases are involved, your census within the facility. It asks you to identify like signs and symptoms. And then when you hit send, that form goes to child care licensing. And it also comes to OPHIE for our outbreak at health.nv.gov email address. So when you complete that form, I know some individuals will email us at outbreak@health.nv.gov as well as filling this form out, but this form does come to us. One of the questions on the form is, did you notify OPHIE? So this is how we are receiving our notification. In the event that you don't have this link or this form isn't completed, then you can email us at outbreak@health.nv.gov, and you can notify us in that way as well. When I receive emails that way, I do let child care licensing know. Myself and other staff members do have access to that inbox, and so we forward those emails on. But this is the most efficient way to notify child care licensing as well as OPHIE that you have cases in your facility. So I just wanted to provide the number for your county health departments because it does ask if the county was notified as well. So if you live in Quad counties, which includes Carson, Lyon, Douglas, and Story, you can contact them here at this number. If you're in Washoe County, their number is listed, and then Southern Nevada is at the bottom. And then with them, once you call their main number, just hit option number 2, and that you can call those numbers 24 hours a day. Well, at least for Southern Nevada Health District. I didn't have that information for Quad County or Washoe. I see some people writing down, so I'll give you a minute to get those numbers before I move on to the next slide. All right, you got the numbers down? Thumbs up, thumbs down, thumbs up, okay. So once you send in your notification through using the survey from child care licensing or emailing us at the Outbreak email address, I will assign one of our HAI staff. So if you send an email, I'll include you in the email just so you know who's going to be contacting you. Otherwise, I will just forward the form you completed to one of my staff members and ask them to follow up with you all on, your cases and get the exact details of what's going on. So what my staff uses is what we call somebody needed, see, there you go. What we use is called an interfacility transfer notification form. And this form collects, if you do have the laboratory information, so we'll get like the actual disease that was identified through lab testing. If tests are pending, it will also collect that information. The onset date for symptoms for your staff and or the children, how many cases are included, the total census, which includes staff and the children at the facility. It also will collect signs and symptoms. And then we kind of get just a rundown of, what happened, when did you start seeing symptoms, when did the parent call to notify or your staff to say that they tested positive or were having signs and symptoms of whatever they're dealing with. We ask about your cleaning and disinfection procedures, the types of chemicals being used. So don't feel like we're being intrusive. It just lets us get a clearer picture of what's going on at the facility. Based on CDC recommendations, if the appropriate practices are being followed. And then if not, it helps us to understand what type of educational material and links to send you from CDC. Excuse me. So Once we collect all of that information, our team is notified of just to be abreast of what's going on at the facility, and your HAI lead will set up a REDCap account for you. You'll receive an email that asks for you to set up your password. We usually will set up, well, not usually, we set up the username. And then once we have all that information set up and your facility linked to your user account, it'll automatically send you an email. For whatever reason, if you do not receive an email, please let us know. I know a lot of times people are having issues with receiving those emails. Sometimes it goes to junk or spam, but you won't be able to report until you get that password set up email, and it also provides you with the link to access REDCap. So this is what the login page for REDCap looks like. So you'll put in the username that we provide and then the password that you set up. For whatever reason, if you forget your password or you get locked out, let us know, because we can work on the back end of this database. So we can reset passwords and different things like that. If you have staff who were the designated reporter into REDCap and they leave, we can reassign a new user and then make sure their access is removed from your account. So any staff changes, we need to be made aware of those as well. Otherwise, especially in the event if somebody leaves under unpleasant circumstances, you don't want them having access to this database, and they will continue to have access until you let us know so that we can remove their access. So let me log into my account quickly, and then we will go through how to use REDCap. This would be the one time I have technical difficulties with REDCap. I apologize for this, guys. It's making me reset my password.
While Kamisha's working on that, this is Denise. Can you hear me?
Yes.
Great. Okay. I just want to let everyone know I posted in the chat box the link that Kamisha was discussing for reporting for your facility, the one that she said generates a report to both childcare licensing and Kamisha's team. So the link is in the chat box, and that reporting form is accessible on the childcare licensing homepage, and I put the link for that as well.
Okay, I'm in. Over here sweating bullets. Okay. Okay. All right, and there's a way. Okay. Can you guys see the reporting form? Okay. So when you enter, you will click here to select your data access group. That is just the name of your facility. And then your facility name will appear here in this list. So this list is based off of how your name is listed on your license. It may not be the, I guess, general name that you call your facility, because we pulled this data from the licensing database. So those were the names that were used. So I know some people have issues and they say like their name is not in there. It may be D and then whatever your facility name is, or A, which we have a note here. So just kind of look through those options and not go straight to what you call your facility. And then it'll ask if you're certain if your facility name is not here. You'll have to enter your county of your facility, and then the name, first name, last name, and date of birth of the person you're reporting. You may have somebody who is not yet tested but symptomatic, so you would still enter those individuals even if you don't have the lab results. And I'll show you where there's an option for you to put like the lab result is pending, and I'm not sure we have a not tested, but you can put them under pending until you find out more information. Onset date, be sure the onset date is the date their symptoms began. Sometimes that will be today, so you can click this button, but unless you're dealing like with a newborn for date of birth, don't click on today, or else we'll call you back and ask for the actual date of birth. The role of the person, yours will fall under either staff or student. And then if staff, you can state what their position is here. If they're a teacher, nurse, the director, and then the county of the staff member or the staff member will go here. And that is because if they, let's say if you're, especially if you're up north, that's usually where we see it. You might work in Story County, but you live in Washoe. So as far as contact tracing, Washoe County would be the one to do the contact tracing. So we need to make sure we inform the correct county health department that they live in. So that's why we ask for this information here. And then their phone number, as I mentioned earlier, is so that the health department can reach out to them to perform contact tracing.
Kamisha,
Yes.
before you go too far, I just wanted to mention also for onset date, if the individual is asymptomatic but had testing done and was positive, the onset date would be the date of specimen collection.
Yes. And there's a note here. Also, when you log in, you'll see this where it says or specimen collection date if asymptomatic. So if they have no symptoms, you can't say when symptoms began. And for the collection date, that is, you can just ask them what date did you go get tested, or, you know, it's also on the lab report for the it'll have it listed collection date. For the symptoms, where's my cursor? We have 8 drop downs, 8 sections here for symptoms, and there's a list. So you can select any item out of this list as far as what symptoms they're experiencing. And if it's not listed, you can click on other. And then there's a comments box below where you can fill in the exact symptoms if they're not listed. Date symptoms resolved would be when they no longer had symptoms. So like with COVID, if they are symptomatic, it would be, of course, when their symptoms resolved. If they are asymptomatic, it will be once they met the clearance criteria. So that would be 10 days from when they tested positive. 10 days from their collection date, I'm sorry. So 10 days from their collection date would be their resolve date, and then they could resume work or come back to the facility on day 11. Duration of illness is an auto-populated field, so don't try to click on this and enter anything. and you can go back into this form. Once you save it, it's not locked. So if anything changes, you need to update. If there's pending test results and then you find out they're positive or negative, you can always log in and click. It'll have the person's name listed, last name first, last name, comma, first name. You can click on, it'll be a colored button. So red if you left it incomplete. I think yellow is like unverified and green is complete. So whatever color that button is based on how you left the record, you can click on that button or you can click on their name and it'll open this form back up. And then you can come in and edit information. Were they hospitalized? Yes or no? And like all these are pretty straightforward yes or no questions about emergency room visits, private physicians, if they passed away. Age will be calculated. I believe at the bottom when you click today's date, it'll ask what the date is, and you can click today. So based off what the day's date is and the date of birth entered, it will auto-populate this field on what their age is. So this is another field that auto-populates, and you don't have to worry about trying to click on it saying this form doesn't work. It does work, it's just waiting for more information to fill this field in. For gender, you'll select whichever one applies, as well as for ethnicity and race. And then if you need to put in a description, you can write that in here. And so this part will be a little tricky for you all just because our healthcare facilities use this form. So they're more aware of the type of test performed. So like Binax Now or the antigen tests are those rapid tests where you go into like urgent care, your doctor's office, and you get your results in like 45 minutes. PCR usually take maybe 24 hours or maybe between 24 to 72 hours. Those, like I said, take a little bit longer. And then like here, if they're tested or you're not sure of, well, actually we have not done here. So they have symptoms but not tested, you can click not done. If they have symptoms and have been tested, but you do not have those results, you can click here for pending. And then if you get more information regarding their lab results, you can come back and change this information. Depending on where the test was done, we have a database where we can pull lab results, and then we can update this information for you if we're able to find the actual lab. Or in the event that the person has the lab and they provide it to you, you can fax it to us or send through secure email only. Please do not just regular email patient information, well, your attendee information or staff information, because it's not secure. So if you have a way to secure it or encrypt it, or we can take that information over the phone, or you can fax it. As I said, we have electronic fax. So I'll put our electronic fax number in there. That comes to me and other staff members as well, and then we can direct it to who it needs to go to with our staff. But I know sometimes I've received through just an unsecure email information that should have been protected. So I just have to, let people know not to send information that way.
Kamisha, this is Jen Connolly. Another option is to email us and ask us to encrypt it for them as an email back to them, and then they can reply in that encrypted email.
Oh, well, thank you very much, Jen.
You're welcome.
So once you fill out the laboratory information on if they're positive or negative and the type of test used, if you are aware of that information, be sure to click this drop down here for laboratory agent detected, because if you don't, we will see that they were positive, but we won't know what they were positive with. So you want to click on this drop down under the lab results, and then it has a list of items. And then, of course, if what you're dealing with in your facility is not listed, you can click other. And then here's the comment box that I mentioned earlier for symptoms that were not listed in the drop-down box. You can write them down here. Some people want to just provide extra information regarding the person in regards to COVID, if there was travel involved, if they want to give, well, we have information further down for vaccination status if you're aware of that. So people use this comment box for various items, but if there's things in these drop downs that are not listed, in relation to what you're trying to enter, you can just put other and then write it in yourself here. So it has here for today's date, which you can click today, or you can type it out in the field. And then in regards to COVID, if they're vaccinated, yes, no, or unknown. If there are laboratory results or certain records that you want to provide within this form, you can click upload and then choose file and go to on your computer where you have the file and upload it. And then we can access it that way. So if you need to send laboratory results, if you have them and you can't fax, you can scan them onto your computer and upload them this way. The case status is what affects that button that I spoke of earlier, turning it red, yellow, or green. So confirm, oh, sorry, that's not that, my bad. So confirmed is for those that are confirmed through laboratory tests only. Sometimes, especially when we deal with like scabies, they will take, the child to the doctor, or the person will go to the doctor and they'll say, look at it, oh, it's scabies. Well, we can't go off of that. If we don't have a lab to back that up, then it's a probable case if they have signs and symptoms that are related to that. So only choose confirm if you have the lab to back that up and it states that that's what they're infected with. Otherwise, you can do probable. If you're not sure, I guess just hit not a case, and then we will try to work out and get a better definition on if it's a case, probable, or confirmed, or truly not a case. We provide the PUI and case ID number, so don't worry about that. Actually, sorry, this is DPBH use only, so you don't even have to worry about this field. Sorry for going through all of that. Form status is what affects the color of that button. So if you make the form complete, the button when you save it will show up as green. If it's unverified, it will be yellow, and if it's incomplete, it'll be red. Some people they determine these to be different. Completed means I've completed this file, there's no missing information. Some people use it as complete as if the case is resolved. It really doesn't matter with us. We just want to make sure we have complete information on this form for us to do our investigation. So, if you want to leave it as complete or incomplete, either way, as long as we have the information needed, we are fine with that. And then please make sure when you finish, if you need to check the information, you want to save it just to make sure you don't lose anything. And then you can stay on the form and scroll back up and look at different information to make sure you have everything correct. Or if you're done with the form, you can click Save and Exit Form, and then it'll save it. If you just back out of this and close out, it will tell you you didn't save your data. Do you want to save the form or do you want to continue? If you cancel it, you have just erased everything you worked so hard to enter. So do make sure that you save this form so that you don't lose the data. So see, I hit cancel. Make sure you want to cancel and lose all changes made on this page. Make it changes, so that's okay. And so that's REDCap in a nutshell. So just to go over a few CDC recommendations, can a student or staff member come to school while in isolation? So the terms isolation and quarantine are usually used incorrectly. Quarantine is when you have been exposed, but we do not know if you're positive or negative or not. Isolation is when you are a confirmed case and you are isolating for that 10-day period. So even in quarantine, there is a shortened quarantine status or process, not status. With that, they would need to be tested on or after day 5 of their date of exposure, and then have no symptoms and also test negative. As long as they have no symptoms and they test negative by day 7, they can return on day 8, and you will continue to monitor them for signs and symptoms of COVID for the remaining period of their 14-day period. If you do the non-test-based method, the first one was a test-based method. If you do the non-test based method for quarantine only, they would have to remain symptom free for 10 days. If they are not able to get tested on day 11, they can return with monitoring of signs and symptoms for the remainder of the 14-day period. Now, that is only for people who have been exposed, have not developed any type of signs or symptoms, and if you do test-based method, they have tested negative. If they are a confirmed positive, even if they are symptom-free, they have to complete that whole 10-day period. They cannot come back early. I know some people have had instances where maybe the staff member or the parent got the child tested again within the isolation period, and now they're testing negative, and then say, well, they tested negative, they can return, but they are still within that 10 days. They cannot return prior to 10 days if they have tested positive for COVID-19. For norovirus and confirmed norovirus and flu, even if they are not a confirmed case but have symptoms related to norovirus, COVID, GI illness, or we'll say respiratory illness, they have to go 48 hours since their symptoms resolve with the development of, with no new symptoms. So once they have reached that point, then they can return. And the time frames are different based on what infection you're dealing with. So your HAI lead can let you know when is the return time frame based on what's going on in your facility. But I know with COVID, we see that a lot of staff and children trying to come back. I mean, especially with the kids, like we understand parents have to go to work and having to stay out, and then, you know, they've been exposed to the child, so now they have to quarantine. And, you know, people need to work and they need their jobs, but we also have to be mindful of the other children and staff and their families that are also in the facilities. In the instances where people have done that outside of our guidance, it has resulted in continuing the outbreak within the facility. So just make sure if you have those questions, and we can provide you like the CDC recommendations, so you can provide that information in writing to parents and staff so that they have it and know that these are the CDC recommendations and guidance that we're enforcing. So, you know, it's not a matter of being mean or just pulling, you know, time frames from the air. Like, these are the stated guidelines that we all have to follow in healthcare facilities and daycare facilities alike. So I tried to be quick so you guys have enough time for questions. So feel free to type questions in the chat box, which I saw some things come through. If you have a question, I know there's like a raise hand option. There's a lot of people on, so we just want to try to keep it organized as possible. And take yourself off of mute and you can ask your questions. And we have plenty of professionals on this call who have been working with COVID since last year, and also working with the child care facilities as well to be able to answer them to the best of our abilities.
And Kamisha, I can read the questions for you and maybe manage if people raise their hands.
Okay.
So one of the first questions is from Nicole, indicating that she had reported cases and didn't ever receive an email back. So I'm asked her to email me directly and we'll follow up with her on that.
Okay.
And then the next question is from Kathy Yoder Bass. And it's, if we are to enter every kiddo that has symptoms, what if their parents refuse to get them tested? So my first thought on that is during this time of COVID, we have to assume it's COVID until it's proven otherwise. So because COVID has the longest exclusion period, if we assume it's RSV, they would be allowed back sooner than if it was COVID. So without a test, those children should be excluded as if they have COVID. So it should be exclusion based on the COVID guidance, which is 10 days. And Kamisha, I didn't know if you wanted to add anything else to that. And if you were to enter that person into REDCap and they weren't tested, there is a choice for not tested. So you could put that, and then in the additional comments, if you could provide some additional information on that.
Denise, this is Jen Connolly. I'd like to add to that. I agree completely that if the parents are unwilling to take them to get tested, to exclude them from being in the child care facility for that 10-day period, that might actually also encourage parents to go seek to get tested to get them back in sooner. And therefore, we would actually know if it truly was COVID versus maybe RSV or influenza, being that most of the PCR tests that are done at facilities do a broad spectrum of testing now.
Great, thanks, Jen. Okay, next question is, can we get an email with all of the presentation pages that you're showing? So we did record this, and so the recording will have the slide presentation, you know, as part of the recording. Kamisha, is it possible for us to also make the PowerPoint available separately? And you're on mute, Kamisha, I think.
Okay, that better. I said I can email it to child care licensing, and I guess we can work to send it out on the listserv or maybe post it on their webpage some kind of way. But I'll work with them to get that sent out to everybody.
Great.
Kamisha, Teams also gives you the ability to attach it into the chat, and people sit through the meeting link.
Learning so much tonight.
Okay, and then Kathy had another question. Why would the COVID return criteria be different for the Clark County School District? They are allowing positive kids back within the 10 days if you provide 2 negative tests. So we'll have to follow up with them on that. The criteria that we are following is the CDC guidance. I put the link to that guidance in the chat box. I am not aware of guidance from CDC that includes those guidelines. So that may be something special that is happening in Clark County School District based on their work to try to keep kids in school. I suspect what they're doing is 2 negative tests 24 hours apart or something of that nature. But we can follow up with them on that. And then Donna posted, is there a resource with the stated guidelines of what was said?
I believe that information is on Nevada response. Is anybody from child care licensing on with the link or where facilities can go to find CDC guidelines for child care facilities?
I can put the the general CDC guidelines for child care facilities in the chat box. I don't completely understand that question. I'm not sure which guidelines the question is referencing. Donna, if you wouldn't mind posting a clarification. And in the meantime, we'll go on to Anita's question. What are the specific requirements, regulations regarding masks? Is it in writing somewhere that we can show parents who question us on their children needing masks? Yes, that is something that's covered in the CDC guidance for child care facilities. And it's been in place since the Delta strain has been the predominant strain, that the recommendation is that 2 and up wear a mask in child care facilities, regardless of vaccination status. And actually, Sean, maybe while I'm managing the questions, if you wouldn't mind posting the link to the CDC guidance for childcare facilities in the chat.
And for whatever reason, it's not giving me the little paper clip to attach my presentation in here. Normally it pops up as soon as I click on the message, but it's not showing. So I'll work on getting that available for you all.
And then Donna has a question. Do we have to report kids that weren't in attendance or affected anyone at the center? I would say yes, because you should be speaking with your HAI lead, with Kamisha's team to make that determination. And Kamisha, would you?
Yes, I agree. There are instances where, you know, somebody is reported, but they haven't been in the facility for 5 days or so. So each situation is different. So it's best to just work with your HAI lead to make that determination on if they need to be reported into REDCap or not.
And then Kathy had a question. Is there an email or phone number parents can email or call with complaints or questions? We have some challenging parents that don't want to believe us when it comes to the guidelines, even when we print them the supporting documents and provide them with many resources that support our policies.
I am not aware of a number for parents to call. Complaints, is that the same process? Anybody from childcare licensing, like the, I know the healthcare facilities, they have a link on the ACQC website where you can file a complaint and then ACQC will follow up with that. I don't know if it's the same for childcare licensing or not, since you guys are under them as regulatory.
Hello, this is Erica with Childcare Licensing. Yes, if they want to submit a complaint, they can go to our website and we have a link there where they can complain. Usually they will complain if the center is not following the regulations, but I'm not sure if the question is more like if the parents are against it and they want to talk about it. So I'm not sure about the question, but if they have something to, like, if they're like, if they think that the center is not cleaning enough or, you know, things like that, they go to our website and they can complain about it.
Yeah, it's not about the center, it's about the policies. They just don't agree with the policies. I've had parents threaten to sue us because we won't let their children come in. They say we're violating their rights to free education. So just
okay, hi, this is Letitia from Childcare Licensing. Can you hear me?
Yes.
Yes, okay. I'm sorry, I've been trying to talk and my audio wasn't working. But you're welcome to send your parents, the parents have been calling the Childcare Licensing office, and we have been giving the information and giving them education and letting them know that we are just adhering to the governor's executive decisions as set forth. Also our own also the CDC guidelines. We're letting them know where our authority is coming from and what have you. That is not to say that they agree with or they get off the phone any happier than when they got on the phone, but you are welcome, childcare providers, to provide them with the childcare licensing phone number so they can speak with us and they can at least know that you have the support from state licensing, childcare licensing in regards to what you're instituting. And we can give them the same information that you're giving them as well. But I have been getting phone calls and I can continue to take those phone calls.
Thank you.
You're welcome.
Hey, Kamisha, this is Jen Connolly. Can I just add something based off of the American Pediatrics Association that since 11/25, there have been 133,000 new child onset cases of COVID-19. Not necessarily that they are severe cases, but they are very active in the case that they are able to pass that on. And within that scenario, it represents 22.4% of the weekly reported cases currently of COVID. And there has been a 4% increase in the cumulated number of child COVID cases since the beginning of the pandemic from 11/18 to 12/2. So You know, children are definitely being affected by this, and even if they are not severe cases, they are definitely able to spread it, and therefore this is a very high-risk situation amongst facilities. And I can put that in the link as well.
Thanks, Jen. I just added the phone number for childcare licensing, just in case you don't have that. It is in the chat for those on the phone. It is 702-486-6660. That's 702-486-6660.
I think that's actually our fax. I'm going to go ahead. Our main line is.
Is it the 3822 number? Oh, there we go. Sorry, I apologize for that. I looked at the wrong number. 702-486-3822. Their phone number is 702-486-3822. I'll just stick to presenting.
Stop, you're fine.
That's okay, Kamisha. I posted the wrong link initially when I said I was posting the link for communicable disease reporting. I actually posted the link for facilities to report incidents. So I clarified that chat up above for any of you that might have copied those links. That's been corrected now.
And also I'm going to put in the number for Northern Nevada for Carson City area. They can call us 775-684-4463 for Northern Nevada if that's more convenient for anyone.
There was a follow-up question to the mask question. It says, thanks. On the mask info, we have shown the CDC recommendation, but we get pushback on the word recommendation. So I can put the link to Directive 48, which is specific to K through 12 schools, but given the age of the children in childcare facilities, or even potentially more vulnerable, these recommendations should be the same. So the use of face coverings is required for all students and staff, regardless of vaccination status, in schools that meet the following criteria. So in counties whose population is equal to or greater than 100,000, so that's anybody in Clark County, Washoe County. I don't know if any of the other counties reach that. And then if there's an outbreak in the school, then everybody should be wearing masks. And so if you have one case, that means everybody should be wearing masks. And then if it's a population, a county whose population is less than 100,000, then it depends on the school district or school. So we don't have a similar document for childcare facilities. This is Directive 48. That's specific for K through 12, but we would follow the same guidance for childcares.
Well, this is Letitia Brown from Childcare Licensing. Governor Sisolak actually sent out a directive regarding childcare facilities in Directive 45, so that we can also adhere to the CDC guidelines, and that's the information that we've been giving parents and the information we also give childcare facilities. So again, if you guys want to just contact us or have your parents contact our office, we can give them that information. We'll go ahead and resend this information out on our listserv so that you can have that information as well as far as the directive is concerned. And hopefully that can be helpful documentation for you too. Thank you.
Okay, so next question, am I hearing you say that teachers/staff need to have a negative COVID test before they can return to school if they were exposed but were asymptomatic? So when Kamisha went over the quarantine guidance, there are two options for quarantine. So 10 days without testing and 7 days with a negative test. So if they test on or after day 5, and it's negative and they're still asymptomatic, they can come back on day 8. If they don't test, they can come back on day 11. And that is covered in the quarantine and isolation CDC guidance that I posted up above.
This is David Singer. I just got clearance for my son, who's a 9th grader. It was 9 days without a test, and he was able to go back to school on the 10th day.
And what school district is that?
Douglas County.
Okay, so I can't speak to what that county said. We're following the CDC guidance. So I can post the specific language in the chat box, but it is covered in that link for quarantine and isolation. So it's 7 days with a negative test and asymptomatic, and 10 days without a test coming back on day 11.
And one more follow-up question is state child care licensing following the CDC or the governor's mandate?
This is Letitia from Child Care Licensing. The governor's mandate is to follow the CDC guidelines, so we're adhering to that.
And I put the quarantine and isolation guidelines in just in case you missed Denise's link earlier. So it's right at the bottom in the chat.
Nope, I did see that, but so that means all children over 2 years of age need to wear a mask.
Yes.
That is correct, yes. It's not to say that we don't understand. We know that with toddlers and with young children that it's hard, that it's a difficulty. What we're really looking at, we're trying to work with the community. We're not trying to be punitive at this time. We're working on safety. So what we're looking for is facilities to facilitate that the kids are putting the mask on and trying to keep the mask on, especially for those younger ages, 3 and 4, where it's hard for them to keep it on and they might take it off and they keep their hands in their face. We're looking for the child care provider to provide guidance to the children to make sure that they are at least trying to keep those masks on during the day.
Thank you, Ms. Brown.
You're very welcome.
Another question is Washoe County Social Services requiring masks for 2 and up. And I apologize, I haven't looked specifically at Washoe County guidelines. Letitia, do you know if they're doing anything different than what we're doing statewide?
You said Washoe County, right?
Yes.
Washoe County Child Care Licensing, as far as I know, is doing the same thing as the state of Nevada Child Care Licensing. That is my understanding at this point. They haven't made me aware that they're doing anything different. I was on the phone with them today and they didn't mention anything different, so.
Thank you.
You're very welcome.
And then I think the remaining question is Donna's question. Is there a resource with the stated guidelines of what was said? So hopefully that's been addressed with the various links that we've posted in the chat. But if not, Donna, if you could please post another question or raise your hand.
We just got another question just to clarify. So we are now doing the mask mandate for 2 and up and not 5 and up anymore. Yes, RG, it's 2 and up according to CDC recommendations.
And we did send it out on the listserv a couple of months ago, and then we sent out a reminder a few months after that. So we'll go ahead and send out another reminder on our listserv in regards to mask mandates in child care facilities.
Okay, we are at 7:01. We had some great questions. Are there any more before we close out? I know it's been a long day for everybody, if you've worked all day like I have. So we hope you enjoy your evening and get some good self-care in, which is very important for all of us. Thank you guys for attending. We had a very great turnout. I will get these notes to Child Care Licensing so that they can send out the presentation notes with the numbers and all that good stuff. Thank you, Tammy, for the thumbs up. And I might just get a slide with the links shared in here so I can put those in the slides as well to make it easier for you guys to have all of that information accessible. Thank you to Denise and our infection preventionists. I'm not sure if Fatih was on, but Jen, thank you for your feedback. Child Care Licensing, thank you for your attendance and feedback, and we hope you guys have a nice night.
Thank you, Kamisha.